A cholesteatoma is a skin cyst deep within the ear and sometimes into the mastoid bone. The mastoid bone is the part of the skull behind the ear. Cholesteatomas form as a result of repeated ear infections, which almost always begin in childhood. Repeated ear infections weaken the eardrum, allowing it to collapse inward, which we call a retraction. Once the eardrum is retracted, it can develop into a cyst, which then fills with trapped skin, causing the cyst to expand. The expansion of this cholesteatoma can destroy the ear bones of hearing and spread into the mastoid. In very rare situations, it can spread inside the skull and endanger the brain. In most situations, the patient experiences a pus-type foul-smelling drainage from the ear. Treatment with ear drops and antibiotics is ineffective, or at best provides only temporary relief. A cholesteatoma is a serious condition, and the treatment is surgery to remove it. Depending on the extent of the disease and what structures have been damaged, the patient may require several operations. It is important to note that the primary purpose of the surgery is to provide a safe, healthy, non-draining ear. We all recognize the importance of hearing, but sometimes hearing cannot be fully restored with surgery if the cholesteatoma has done too much damage. The surgery for cholesteatoma is called a tympanoplasty and mastoidectomy, or tympanomastoidectomy for short. The surgery can go by other names, such as mastoid surgery or mastoid cavity. The surgery is done under a general anesthetic. This surgery is an outpatient procedure, which means the patient goes home from the recovery room, and the surgery itself takes about an hour or two. The incision is behind the ear and down the ear canal. There is usually packing in the ear canal, which is taken out in the office within about a week. Healing is complete by 4 to 6 weeks.